Today's topic is going to be basically two things. We're going to cover what's called the value of a statistical life and then benefit transfer. Those are kind of the two things on the agenda for today. If you remember from the cost of illness table, we had a part of the revealed preference or a part of the non-market valuation lecture where I talked about the cost of illness. We had a table of values for people that got sick or that had a case of the norovirus in 2013. Some of them just recovered on their own. Some of them visited a physician and had to pay medical bills. Some of them actually went into the hospital and spent some time in the hospital. And then some of them unfortunately didn't survive. And we had some values in that table. If you think back to that cost of illness table, some of the values in that table were referring to the cost of the excess cost to society of those people that did not survive. And the ways that those numbers would be arrived at, likely, I don't know precisely how those were computed, but I imagine that they were computed using this value of a statistical life technique. That's the most common way of putting a monetary value on policies that prevent excess deaths. So this is we call it the value of a statistical life because it's not the dollar value that you put on any particular person's life or your own life. It's the value of reducing the risk of death in the overall population on average. So it's kind of a statistical concept. So anytime the government is doing something like setting a speed limit on the road, they're implicitly making some kind of cost-benefit trade-off, or they're kind of the speed limit that we accept as a society, the speed limit that we sort of lobby for and agree upon, is kind of implicitly accepting a trade-off between risk of death and a little bit of a more convenient lifestyle. If you increase the speed limit, you get to where you want to go a little bit faster. You're able to pack more activities inside your day. You're able to get a little bit more out of life, at least in terms of activities. But you also, in the event that you get in an accident, it's more likely to be a fatal accident if it's 70 miles an hour versus 60 miles an hour or 55. So implicitly, there are trade-offs in our everyday life as we are going about our lives. We're accepting certain levels of risk in order to have a little bit more of a convenient sort of lifestyle. And so the government's decisions about things like the speed limit or how much ambient air pollution to allow to hang over an urban area, those to the extent that those things save lives, which on average they do, we see that there are fatalities on the highways. We also see that there's excess deaths in places that have higher ambient air pollution. So to the extent that those policies, the speed limit policies or the ambient air quality policies, limit excess deaths or prevent excess deaths, it's helpful to have some kind of number to put on that so that we can understand what are the benefits of using resources in that regard versus using resources in some other way. So that's why it's important and necessary to have some kind of valuation on this, because if there's no valuation, then we don't know exactly what the benefits are of controlling air pollution, and we can if we don't try to measure this, we can end up with less control because we can't quantify what the substantial benefits of reducing those deaths actually is. We have no way of comparing it to the substantial costs that we might have to incur along the way. Okay. There's sort of, broadly speaking, I sort of identified three different ways that this value of a statistical life can be arrived at. One of them is, we're already familiar with this kind of approach, but it's the contingent valuation approach. That contingent valuation is the first. Consumer purchase is another. We can look at consumer purchases. And then another method is called the wage risk analysis. Okay. And I'll just mention, I may refer to value of a statistical life as VSL. That's a common abbreviation. So keep that in mind. It's sometimes referred to as VSL. It's a lot easier to say. So I'm gonna go through each of these three approaches right now, effective immediately. So this contingent valuation approach, we've already seen something like this before. What this might consist of is a survey that might try to elicit willingness to pay, maybe for a reduction in ambient air pollution that will result in 50 fewer deaths per year. So you might have a survey asking people, look, there's a new method we have to control emissions of volatile organic compounds or nitrogen dioxide or sulfur dioxide, and we expect, based on uh, epidemiological stuff, based on what we know about the human body and the way it responds to those concentrations of those chemicals, we expect that 50 on average 50 fewer people are going to die from that, specifically from that pollution. And so you sort of give them information about that that opportunity to save kind of lives on average. Maybe you consider your own health risk. Maybe you have asthma, and so you're willing to pay a lot more because that kind of thing would affect you more. Maybe you don't, in which case you have a little bit lower willingness to pay. But you sort of sample the population. You figure out what on average do people want to pay for some kind of measure that would reduce average deaths per year from air pollution by a certain amount, and maybe you get a number from that. And so you get something like you take a sample, and you get some sort of willingness to pay per household, so some dollars per household, and then you maybe want to extrapolate that to the whole population. So you'd multiply that by the number of households that would be affected by that policy, and then divide that by the number of lives saved. So these would be the sort of the total willingness to pay. Willingness to pay per household times households would be the total willingness to pay in that population, divided by the number of lives that would be saved in that population. And that could give you an estimate of, that would help you to come up with some estimate of VSL. And it's going to, any individual study is going to come up with a different number. And we have a range of these values. Typically, it can range from 2 to 3 million at the low end, up to 15 or 20 million at the high end. And the EPA right now, I just looked this up this morning, they use a value of about 10 million when the EPA is using when the EPA is evaluating policy that will have lives saved as part of the benefits. They use a value of 10 million per life saved. I think the Department of Transportation uses a little bit lower number, maybe like 6 or 7 million when they're doing engineering on the roads, when they're thinking about, okay, what kind of speed limits do we want? What kind of curvature of these turn do we want? We want to make sure that there's visibility in these traffic lanes. We want to put a stop sign at this corner because you can't see around the corner, so we want to make sure people stop before they get to that corner. When traffic engineers are designing policy, what they're doing is also affecting the probability of accident fatalities in cars. And so their evaluation, when they're doing cost benefit analysis, they're also using VSL. And different agencies or different governing bodies can will look at the literature and decide on different estimates of VSL according to the research they're looking at, also according to maybe just their priorities of whether they prioritize expediency and convenience versus lowering mortality risk. So this is one way. Contingent valuation methods is one way of getting at the VSL. Another way of getting at it is looking at what actually what people themselves spend on extra kinds of features or safety features, either in a car or bicycle helmets or safety equipment in sorts of activities that have some sort of mortality risk. Driving being a very prominent one. And so if a lot of cars these days have it's not all standard on all cars, but some cars come equipped with different kinds of accident prevention features, like braking assist if you get too close to the car in front of you, or it might vibrate the steering wheel a little bit if you start to drift into the neighboring lane. And you can pay a little extra. Those features are costlier, and you can pay for a car that has higher has those features installed to a greater extent. And in that way, you can actually observe kind of how people are themselves spending their own money, sacrificing their own money in order to get a little bit of a lower mortality risk. And so there was a study in the last few years that looked at sort of the value of a statistical life implied by the purchases of bicycle helmets, and sort of the value that parents placed on reducing the mortality risk of their kids. And so just a simple example of how that would be calculated. They found that the cost of a bicycle helmet is about $6.50 on an annualized basis. So that's not the actual price of a bicycle helmet, but it's a durable good that you would expect to be able to use multiple times over multiple years. And so the number they used was that it's about $6.50 per year for a bicycle helmet. And in this particular study, there was roughly 32, maybe this was based on the data from that particular year, but there were about 32 bicycle accidents that resulted in fatalities for kids aged 5 to 9. 32 fatalities among a population of about 14 million 5 to 9-year-olds in the United States, which comes to a mortality risk of, I believe this is 5 zeros and then a 2 and a 3. That's what this 32 divided by 14 million would give you. So if you assume that this isn't strictly speaking true, but if you assume that having a bicycle helmet is going to prevent your risk of death, for all the children that would have died in these bicycle accidents, all of these 32 children, if we assume that all those lives would have been saved, or even if you assume that only some fraction of them would have been saved from a bicycle helmet, you could maybe adjust this number. But this is just to illustrate how the number is calculated. You take the expenditure per year divided by the reduction in mortality risk per year. So the 32 children per year fewer are going to be dying from bicycle accidents because of it. Let's just say if you purchase this helmet, you reduce your child's risk of dying in a bicycle accident by 0.000023. That would come to roughly, if we think about that, dollars spent per unit of mortality risk reduced, that comes to about 2.8 million. So that's sort of an implied value based on the observation that people spend this small amount of money per year to reduce their mortality risk a little bit per year. That's one way of another way of approaching it is looking at what people themselves spend on reducing their own mortality risk or the risk of their children's mortality. I think this is probably the most common one, but it's called wage risk analysis. And it has a similar, like the kind of problem is it's another kind of revealed preference approach. So it has a similar structure as the consumer purchase approach, because it's got people sort of either paying a little bit more, sacrificing some money in order to get a little bit less mortality risk, or accepting a little bit more money in order to take on a little bit more mortality risk. So this wage risk analysis is looking at the different fatality rates that occur at different types of jobs, and looking at how the differentials in the wage for those jobs sort of compensate for that. So, one of the most dangerous jobs in America, at least, is logging. That's got the highest fatality rate. Commercial fishing is a close second, I believe. I think those two are some of the most dangerous jobs. One way that you might do this is you might compare the premium that a commercial fisherman makes relative to a little bit of a safer job. So just to put some numbers on it, let's say that a commercial fisherman, the fatality rate in a profession like that, let's say that it's 8 per 10,000 is the fatality rate for commercial fishing. and there's maybe another open career possibility for a commercial fisherman, which might be something like roofing. So this is commercial fishing, has a, let's say, 8 out of 10,000 fatality rate. Let's say if you want to be a roofer, it's, you still have some risk, but it's not nearly as dangerous as commercial fishing. And so maybe that the risk of death as a roofer is 5 out of 10,000. So you're essentially you're reducing your risk of mortality by 0.0003 in that case. So you have like 3 in 1,000 less chance of dying on the job as a roofer. And maybe you observe that there's like a $2,000 on average. There's a $2,000 wage premium, like a difference in salary or wages per year for commercial fishing over above and beyond the wage for the annual wage for a roofer. In that case, you have the premium, the willingness to pay is sort of revealed. It's like as a roofer, you're not, it's not like you're directly paying money in order to reduce your risk of death, but you are accepting less. You're accepting a little bit smaller of a salary in order to have a 3 in 10,000 less chance of dying on the job. And so in that case, I believe this, if you go by this is kind of the willingness to pay, indirect willingness to pay, because it's like you're accepting a little bit less to have lower mortality risk. This 0.0003 is the kind of the additional probability of surviving that you are able to enjoy. And so if you divide that out, willingness to pay, or sort of the premium divided by the benefits, or the dollar value divided by the extra risk of, or the extra probability of surviving, that comes out to, in this case, about 6.67 million, just based on this example. So that would be the result that you would get if you're comparing the premium in the commercial fishing profession relative to the roofing profession. And of course, you'd want to control for whether or not, like, these different professions have different levels of skill that are required, or different amounts of training that are required, or different levels of education that are required. That would also be something that would affect the wage premium. But if you're able to control for that, if you're able to take professions that have maybe just very similar characteristics, similar levels of required education, in this case, kind of roofing and commercial fishing, those are professions in which it's not, the skill difference is not that large. The only difference is that you'd have to maybe learn a little bit of the specific aspects of the job and be willing to kind of work with your hands and be willing to put in that time to learn the job and just work long hours and kind of work a very physical job. So these professions, I picked these because these are perhaps somewhat comparable. I'm imagining that a roofer, if they wanted to learn how to be a commercial fisherman, they could do so pretty easily, and vice versa. Because they have maybe just some basic mechanical skills, basic handyman skills that would translate pretty well from one profession to the next. And the only difference in that case in the wage would result from the extra mortality risk that's being incurred by the commercial fisherman relative to the roofer. So that's another way that we could get at these values. It's not perfect, but that's a very common way. Wage risk analysis is another very common way for us to get a sense of what people are valuing mortality risk in their own lives at, in terms of what they're giving up or what they're accepting in order to take on more risk. Okay. I want to talk a little bit today about benefit transfer, which is a common technique in benefit cost analysis, basically just premised on the idea that new studies are expensive. So hiring research assistants and the labor that you need, hiring the services of a marketing research firm, those things are expensive. Conducting a new study is expensive. You need to design the survey, have experts kind of look at it, experts in survey design have them look at it and make sure that the survey is consistent and coherent in terms of the way it presents the questions. You need to have somebody If it's an in-person survey, you have to have somebody go door to door and knock on doors and talk to people and interview them and collect their responses directly, or stand out on a street corner and do the same kind of thing, and pick random people to survey. Those kinds of things require a lot of money and time and manpower to do a new study. And so benefit transfer is one way of sort of getting around that extra cost. If you can find an existing study that's close enough to the kinds of things that you want to value, you might be able to get away with not having to do your own study, but just using the values that have been estimated in the past, right? So there's the study case. There's what's called the study case, which is the pre-existing kinds of research that's been done. And in benefit transfer, you'd be hoping to take either that study case or study cases and be able to translate them to what we call the policy case, which is actually your case, your question that you're trying to answer, your policy question that you're interested in answering. You want to use maybe existing research, existing studies to make an assessment or make evaluation of some amenity that's relevant for the decision that you're trying to make. There's different approaches or different kinds of methods. There's what's called a unit transfer. You have, let's say, willingness to pay for a particular kind of amenity. Maybe it's willingness to pay for a natural area within a certain radius of your house, and you're trying to decide whether or not it makes sense to preserve a natural area in your own town, preserve that rather than developing it, and you want to figure out what the value is. And so you might go look at a study that was done maybe in a different state in the same country, and figured out, okay, maybe a study was done there and willingness to pay per household was X in that study for a similar kind of good, and so we can maybe take that value. Or you maybe would want to take a number of existing studies, maybe take 3 or 4 or 5 or as many as you can find, and kind of make sure that they're reasonably similar to the case that you're looking at, and maybe take an average, maybe take a simple average. That's one way of doing benefit transfer. Would be just unit transfer, where you're looking at the numbers that other studies found, and you just sort of take that same number directly and translate it to your own case. Another way of doing this would be what's called a value function. And so one example of this, and you're going to get a chance to do this on your homework, or maybe you've already done some of this on your homework, but you have a study that was able to estimate household level willingness to pay, which also estimated how that willingness to pay depends on certain household level characteristics, like income or age, something like that. The income or the age of the respondent might make a difference in terms of, if you think about something like bird watching, that's an activity that's typically you do more of it as you get wealthier and also as you get older, and so you'd have willingness to pay for like bird watching sites nearby your house. Those would be dependent on your age and your income, you'd expect. And so if you have a pre-existing study that estimated how additional $1,000 of income contributes to an extra willingness to pay for bird watching opportunities, or how an additional year of age affects how willing you are to pay for bird watching, then you can take that function and you can apply that function to a new population, plug in the characteristics of that new population into that function, and get a value that you didn't exactly survey that new population, but you did survey a different population and collected information about their characteristics, and you can apply that function to a new population. And even though you didn't survey that new population, you have some idea of how the new kinds of characteristics of that population might contribute to higher willingness to pay. So you have one example of that on your third homework assignment. But there's another example I want to just talk about, which was from an actual policy, the 2002 CAFO rule, which was a case in which, as they were developing this rule, or as they were deliberating about design this rule or whether to pass this piece of legislation, they used benefit transfer to make that decision, or just kind of evaluate whether or not this would be a good rule. And so what this is, CAFOs are confined animal feeding operations. So like a poultry farm, or a swine, a pig farm, which tend to generate a lot of waste, a lot of manure waste, which can leak into streams and nearby lakes or into the groundwater, and reduce the quality of the water. And especially because they're very large operations, they can have a very substantial impact on water quality, especially if you have a region of the country or a region of a particular state where there's a lot of farming going on or a lot of these operations happening. That can have a sizable effect on water quality. And there was deliberations about how to regulate these or whether to regulate these, and what kinds of measures they should put in place to force these operations to manage their runoff or manage their discharges of pollution into the water supply. They wanted to put restrictions on that, and they wanted to see how much, like what was the value of those extra restrictions, because those were going to be very costly. Both the firms themselves, these operations themselves, would have to pay a lot for that, and indirectly that would affect consumers of those products as well. It would affect the availability of those products, or the price of those products would go up as a result of stricter measures that these facilities would have to undertake. And so they wanted to know what would be the benefits of this. And so one of the ways they valued this rule, or this set of rules, was by using a 1993 study. This was a 1993 contingent valuation study. In this case, they used a study by a couple of researchers, Carson and Mitchell, who looked at the willingness to pay. This was a contingent valuation study of what people would be willing to pay to have their water quality go from from like one tier to the next. So this is like going from non-boatable to boatable. That was one of the tiers in this contingent valuation study. From boatable, they would also were wondering what would you be willing to pay to go from boatable to fishable. So fishable would be a little bit of a higher tier of water quality, and then from there another tier would be having your water quality be swimmable. That's a higher tier yet. And so the numbers were, if I remember right, the numbers were something like, on average, households were willing to pay something like $80 for like the first tier improvement, something like $100 for the second tier improvement from boatable to fishable, and then something around $90. I might have some of these switched around, but roughly speaking, this was what they found in their contingent valuation study, that these different tiers of water quality improvement had different values. People had different willingnesses to pay for these different levels of improvement. And so then what they could do, one of the things that this study could do, you have these willingness to pay numbers, and you could make some estimate of how. So you consider, if we enact stricter regulations on these CAFOs, if we require them to manage their own manure, maybe build like a storage tank to hold it, instead of having it just kind of run off onto their land and eventually work its way into the water, they could estimate what this CAFO rule would mean in terms of the change in pollution loads. So they could estimate the loads, the change in the pollution loads that would result from having these stricter measures. Given the difference in loads, that would imply a different level of water quality. So they could say, okay, if the amount of manure that's getting into the water is a little bit less, chemically speaking, we can predict that that's going to make a certain number of non-boatable water boatable. If the quantity of manure that's getting in the water is decreased from this CAFO rule, that's going to make a certain percentage of the water go from non-boatable to boatable. It might make another percentage of the stream or the river go from boatable to fishable. It might make another percentage go from fishable to swimmable, depending on how far away it is from some of the CAFOs themselves. It might have differential effects on the different areas, but you can sort of use a water quality model and make a prediction about how the change in loads are going to translate to, an increase in boatability or increase in fishability or increase in swimmability. And then if you know kind of, how many stream miles, for example, are going to go from boatable to fishable or from fishable to swimmable, you can actually translate that to a change in total monetary value, right? So you would have something like, maybe you have something like a number of households that have their water quality go from non-boatable to boatable. If maybe some number of households are going to be, based on your water quality model and based on kind of how many people live in that area, you might have some number of households having their water quality improve from non-boatable to boatable, and that's worth, that's worth some amount. That's worth, I guess, $80 given the numbers that I had written down previously. And then you might add that to the number of households that were having their water quality improve from boatable to fishable, and that would be multiplied by the unit value of that improvement. And so you'd add that to the equation, and then you'd also consider how many households are going from fishable to swimmable, and again multiply that by maybe the unit value. I don't remember if these numbers are exactly what Carson and Mitchell had, but it's somewhere in the ballpark. It's been a while since I've looked at that study, but you'd add those all up, and you'd get the overall change in value as a result of that CAFO rule. Okay, so that is one application of benefit transfer that was actually used in designing policy. This benefit transfer method used these contingent valuation numbers from Carson and Mitchell 1993, and assumed that those numbers were going to represent the values to these households that would be affected by this CAFO rule, and they were able to kind of extrapolate from that previous study to come up with an estimate of the benefits to the surrounding areas of having stricter controls on these CAFOs. So that's an example of where benefit transfer was used very influentially in actual policy a couple decades ago as it relates to the regulation of these confined animal feeding operations. Okay. One of the things to take away from this benefit transfer idea is that there's a trade-off between cost effectiveness and validity, because if you think about it, having an existing study available that you can draw from when you're trying to evaluate a new policy is going to save you a lot of money. So you're going to have a much more cost-effective approach, a cost-effective research approach, because your administrative costs of the research project in general are going to be less if you use an existing study, or if you use a set of existing studies to estimate the value of some of these changes in quality. So there's a trade-off in cost effectiveness and validity. So if what you gain in cost effectiveness, you also sacrifice something, because you're not directly surveying the direct population that you're interested in that is affected by the policy that you're talking about. You're not doing a survey, or you're not doing a revealed preference study of the particular population that you're looking at in the policy case. You're just using a study case that was conducted and that evaluated the willingness to pay, stated or implied, stated or revealed the willingness to pay of a different population. And so there's always questions if you're doing benefit transfer. There's always questions about whether or not the population that's affected by your particular policy is close enough in characteristics, or is going to have the same kinds of willingness to pay as the population that was surveyed or analyzed in the previous study cases that were done in the past. So that's one of the main takeaways of benefit transfer, is that it saves a lot of money. It's very cost effective. It doesn't require you to spend the resources to take on those extra administrative costs of the new study, but it does lead to some more questions about whether or not your estimates are valid, given that you didn't actually analyze the willingness to pay or the revealed preferences of the population that you're actually looking at for your particular policy.